Hi, everyone. Thanks for joining us and watching this video. I'm here with a friend of mine, Dr. Janet Courtney, who happens to also be the creator of the play therapy approach that we're highlighting in this video clip. It's called First Play. And I'm so excited that you're here, Dr. Courtney, because you're the creator of this. So I'm going right to the source to get this information. Thanks for joining me in this video.
Oh, well, thank you so much for the invitation. I've really been looking forward to this. So how do we describe First Play? Well, basically, how I came to develop First Play is a long story, but it goes back to my work with Viola Brody, who developed the approach of developmental play therapy.
Right.
And her work was working with children at the symbolic level of play, or at the pre-symbolic level of play, where we're not necessarily working with toys with children and like traditional type of play therapy of following the lead of the children in the toy materials that they choose, but it's working with the relationship, just the relationship between a parent or a therapist and the child. So and then what happened is with Viola Brody is she was very much into understanding about the importance of touch. So she wrote a book called The Dialogue of Touch. And so in my mentorship with her and, the supervision that I gained and the training that I understood, after she passed away and I started researching about developmental play, I started realizing there was a gap in our training. And a lot of that is that there wasn't a lot of understanding how to work with the 0 to 2, 0 to 3 populations, even for Dr. Brody. I mean, her work mostly with developmental play was ages maybe 2 at the youngest, but like 3 years old and above, which is what our traditional play therapy models normally come in at. So there was this gap of understanding. And when I started working with infants years ago in an adoption agency, and I worked in foster care, I was learning play therapy at the time. But most of the work was with the babies that I was working with. So this was back in 1989, 1990, 1991, and this is where I was starting to get my training in play therapy. So it wasn't necessarily 100% understanding, oh, there's a gap back then, but I knew there was something missing in our work of like, how do you work with an infant? How do you work with a 2-month-old? So, I mean, I'm giving you the abbreviated version. But basically, I started realizing is that we had these factors of the importance of touch. And then we also had the factors of working with children at the pre-symbolic level of play. And so, and the work with the developmental play is really, she would have trained the therapist how to work with the children to develop attachment. And, children that had maybe diagnosed with many different disorders. Even she works with children with autism too. But she, there was the missing piece of understanding about the concerns of therapists touching children. So, and I even actually asked her that question years ago when I first met her, and she really didn't address it well. And this is where I started realizing, well, we need to start addressing the ethics of touch. So I know I'm kind of talking about different areas right now, but what I'm trying to say is I synthesized a lot of different understandings of developmental play therapy, the research in touch and how important that research is. And then also understanding that we have a gap in our play therapy training, traditionally, to where we didn't really know how to take our work to the youngest of populations. And if we do that, we can't necessarily think about our traditional ways of working in play therapy, where we're going to have the parent maybe in the waiting room, and I'm going to get their child and I'm going to go in the playroom and play with them for a while, and then bring, maybe have the parent come in. Well, you can't do that with a baby. You can't have the parent sitting in the waiting room when you take the 4-month-old baby into the playroom and say, oh, by the way, what I'm going to do between me and your baby is confidential. The parent is like, ah, no. So it has to be relational. We have to include the parents. So how do we do that? So first play then goes back to the understanding of the first type of play. And that's why I call it first play, the first type of play that we have in life. And what is that type of play that we have in life? It's that peekaboo. It's the understanding where the parent has that baby sitting on their lap and they're singing to them. They're saying, here's your eyes, here's your nose, here's your ears. Let's count them and make sure they're still there. It's like playing peekaboo, playing there's a lot of different developmental games, so big, how big is, how big is Robert? So big, I don't know if you've ever seen that, heard that game. Well, anyway, those type of developmental games, and this is what I call first play, Viola Brody called them developmental games, is absolutely necessary. We have to have those type of experiences in our life. And what's happening in those experiences? The infants and the young children are being touched in a caring and an appropriate way. So in that, the first play, I developed it as a manualized model. And I borrowed also from the infant massage material and the infant massage. And I've also borrowed from Ericksonian storytelling, and I give Joyce Mills credit for my understanding in Ericksonian storytelling. So we then work with the infant in first play activities, but we're also doing first play stories with them. And so these stories are basically massage, infant massage type of techniques in combination with Ericksonian based storytelling. So we tell the baby a story while we're, so basically in this manualized model, one of the stories is called the baby tree hug. So we pretend that the baby's a beautiful tree and the limbs are the branches, like the arms are the branches and the feet are the roots and the head is the sun and the ears are the moon, and, and the stomach is the trunk, or the back is the trunk. And so anyway, so we guide the parents in the storytelling, but how do we do it? We help that parent to attune to the baby. We help them to understand about respect. And so we teach the parent how to ask permission from the infant. And, of course, infants can't talk and say, I don't want to be touched right now. So we have to guide that parent to make sure that they're understanding the cues of the infant when they're, so we say cues of infant for readiness and cues of infant when the infant is not ready. And so, so we pull on a lot of the infant mental health literature so you can see we've got touch, we've got infant mental health, we've got the understanding of pre-symbolic play and the first play type of game, developmental games, but also the infant massage. So we're coming in from a lot of different angles to, synthesize, I've synthesized a lot of different material to support first play, to have the foundation for it. So it stands on solid foundation. So again, it is manualized. We've created a 6-session type of curriculum that the practitioners can learn in order to implement this with the parents. And, there's upfront information so that the parents need to understand about the importance of touch and how we touch respectfully, and even being careful of our nails. If we're touching the baby, don't want to scratch them, and and we need to make sure the temperature in the room is correct. And so there's so many different things that
Yeah.
we have to pay attention to. But it's that, it's basically going back to it. Attachment theory too is definitely a foundation, and looking to support the joy within the relationship.
Mm-hmm.
And so all the things I've got out of my training, I was able to train with Sir Richard Bowlby, which was John Bowlby's son, and learning that there's two ways to build attachment. And so one is that, the parent can provide consistent care to alleviate the child's distress. And the other one is the joy in the relationship, is
Sure.
promoting joy. Because what happens in the joy in the relationship, those endorphins in the brain are spinning out, and then they're wiring. That's what wires the brain, those connectors, is those endorphins. So we want to support the joy in the relationship. So I know you asked me a simple question, and I tried the best I can from all these different areas to
Sure.
try to tell you, and hopefully everybody's following me in what I'm saying.
It's challenging. I know it's challenging to, briefly talk about a whole approach, and all the important points in there. I'm thinking as you're talking about, who would benefit from participating in first play, and all these different ideas are running through my head. I'm thinking about families that maybe have generational, dysfunction. And so then when, or maybe like teen moms and dads, or people that might be a little more high risk to the parenting attachment process not going well, would seem like such great candidates for this. But really, any parent could come in. There doesn't even have to be, to me, I'm thinking even some thought of an issue or problem, but just to come in and participate, just so things get off to a right start and a healthy attachment and relationship. But I'll let you say that. Like, who would be like the participants? Who's
Well,
the ideal?
one of the areas that I have been very thrilled about to see First Play getting in the door with is the parents, the mothers that have used substances during pregnancy, and then once the birth happens, then probably the babies have tested positive for a lot of it is opiates now. Back when I was doing adoptions, a lot of it was, we call them the cocaine babies, but now it's a lot of the opiates. But anyway, I've been, the case examples that have been happening. For example, in Sacramento, they have a drug and alcohol treatment program for the county. And if the babies are testing positive at the hospital, instead of taking the babies away from the parents, they have an option and a choice that if they go into treatment with their infant, then they are able to, work towards, getting, clean, and then they can, hopefully have an opportunity to continue to have their child with them. Yeah. So, but what I've discovered in the drug and alcohol field is a lot of the people that work in these facilities, they understand about how to help the parent or the mother or the father, to stay clean and work a program, but they don't necessarily know what to do with the parent and the infant, other than to make sure that they're getting their, that they are getting fed well, and that they're following up with their doctor's appointments, and that they're not harming the infant there. But they don't really have a treatment model to help them with that. So First Play really fills a gap within these centers to train the practitioners that are there to then work with the parents about, to help them, I call it stopping the chain of pain,
Mhm.
you know, the intergenerational patterning of trauma that's
Right.
passed down. And so if we can help that parent, you know, and a lot of them have not experienced, even as children, or even, you know, they've been in domestic violence situations, good experiences of touch for themselves. So they don't know how to necessarily provide good touch to their infants. So we're guiding them in a respectful way about how to touch their babies in a totally different way, other than a lot of them know how to, you know, hug them and kiss
Yeah.
them and give them a lot of love, but they don't really know how to play with them. They don't know how to
Sure.
engage with their babies. And so what we're offering with First Play is a totally different way of being. And then one of the 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 model, one of the case studies, we had a mom, the baby was 8 months old, and she said it was the first time that she'd ever seen her baby smile and laugh.
Wow.
So she knew how to love and kiss and
Hmm.
hug, but she didn't really know how to play with her baby, you
Yeah.
know, how to like, you know, to find some joy in that relationship.
Yeah.
So we opened this whole new door for this mom, and it was like, oh my goodness. I mean, and then the other case studies that have come out of that in different facilities, like we have another practitioner that's working with the drug and alcohol mothers, but you know, and I'd like to get this into the jails. Sometimes
Mhm.
the parents are able to have their babies with them in the, you know,
Sure.
in jails. I'd like to get in there. But I know for adoption, preemie babies, the program down here is called the Teacup program, Teacup preemie program, and Chelsea Johnson has a chapter in the infant play therapy book, if you have that book, where she talks about working with these parents with First Play.
Hmm.
After, usually she starts after the infants get out of the hospital and go home. And because a lot of these babies were so fragile,
Yeah.
and there was such a disconnection of attachment when the babies were at the hospital, that sometimes the parents really don't know. They're still afraid to kind of touch them in some
Yeah.
ways because they don't want to hurt them, you know, they
Sure.
were so teeny and tiny and fragile. And so, and Chelsea Johnson is going in and doing amazing work with these moms, and she's done some trainings on the work that she's doing with
Yeah.
First Play, and she's got some great case studies. And then also infants that have been adopted,
Hmm.
and so we've been able to work with some foster parents as well as the parents that have adopted
Yeah.
the infants. So these are, I'm just giving you, you know, like you're asking the question. Now,
Sure.
the other area is the perinatal depression. And
Right.
but Maylene Velasquez did a chapter in the infant play therapy on First Play, working with a depressed mother and with her infant, and did an amazing job, because we know that depression can interfere with the attachment relationship.
Right.
And so moving in and teaching them how to be able to have a way to kind of even rise to the occasion, even if you don't feel like it, you know, that's part of the depression, is like you just don't feel
Yeah.
like
Sure.
engaging. So if we can help them, you know, provide a way to at least kind of bake it till you make it, you know, you
Hmm.
know, provide some of that touch, it benefits. There's been some research showing that it benefits the parent, and of course it's also benefiting the parent. But we've got that good eye contact going on. We're facilitating the serve and return that's happening in
Hmm.
that relationship, that back and forth, beautiful back and forth engagement. So I just love it.
I can tell you're passionate
Yeah.
about it, and that's
Oh.
good because that's who needed to do this. Someone who is passionate about it. I mean, I love it. I love that there is this very just worthwhile, effective approach out there for this birth to two, birth to three population, because you're so right. You know, when you start talking that there wasn't anything for that age range. And if you think about it, I mean, how powerful is it to get started right from the beginning in these healthy constructs? So I think there are
Right.
people
And all the
who
neuroscience too, it had pointed to that.
absolutely,
And
absolutely. You don't wait till you're 4. You have 4 years then
exactly.
of things not really going well. That doesn't make a lot of sense, right?
Yeah, birth to 3. We know what's happening
Yes.
in those early years with the wiring of the brain. Absolutely.
So I think people will maybe watch this and be very interested. Like, hey, I get this. This is something I might want to start doing. I remember this was years ago. This was before I think you even put this approach together. In this community clinic I was in, just periodically, we'd get this call and somebody would be wanting to bring their infant in. And we'd be like, oh, we don't do that. I think there are people who are really interested in this. So how could somebody get more information? How could they get more
Mhm,
training in
mhm,
First Play?
mhm. Well, I mean, basically I have a website, so you can go there. It's www.firstplaytherapy.com.
Okay.
The infant play therapy book, if you're interested in infants, is an edited book. So it has a lot of different models that people have taken, like filial play therapy, and
Mhm.
adapting it to the infants. So I tried to kind of go out there and said, well, who else is working with babies? And let's
Yeah.
see if we can put together an edited book on that. So it's called Infant Play Therapy: Foundations, Models, Programs, and Practice. So
Okay.
I would definitely recommend that. And then just really diving into the infant mental health field. And, as we have our movie stars in the play therapy field, and, you
Mhm.
go to the conferences and you go, oh, there's Ileana Gill, and,
Uh-huh.
walking down. And, when you go to the infant mental health conferences, they too have their own movie
Mhm.
stars.
Sure.
And so to understand who were kind of the pioneers in that area, and then what is the research in infant mental health, and what are some of the resources that you can obtain, just to kind of dive in and learn a little bit more about. And there's the association called 0 to 3.
Mhm.
And then every state, also pretty much every state, they're getting organized more, has an infant mental health association. So for
Okay.
example, I'm a member of the Florida Association for Infant Mental Health.
Right.
And so I attend some of their workshops, and, I've been able to be a speaker for them as well. And so anyway, I would probably highly recommend that. And then worldwide, there's even a World Association for Infant Mental Health. And I think like every 2 years, they put on a worldwide conference in some really cool place that I really want to have on my bucket list. But I
Yeah.
was able to do the virtual this past summer, which was a lot of fun.
That's so cool. Well,
Mhm.
thanks for those resources. I mean, they'll be posted here on the video so people can copy them down and link to them. And you can go get more information about infant mental health in general, but certainly what we're talking about, First Play, this play therapy approach that is so cool and needed. So if you're interested, go to Dr. Courtney's website for sure. There's great information there, training information there, as well as other resources. So thank you, Dr. Courtney, for sharing this, creating this approach, putting it out there in the world for people. And thank you for joining me on this video and sharing about it today.
Well, I've just been so honored, and you've been such a wonderful host, and I've just enjoyed it immensely. Thank you.
Awesome. Thank you. And you guys, thanks for watching. Come back and watch more videos. Take care.